Hey everyone, especially all the healthcare providers and residents out there. We know you're busy, so we're going to jump right in.
Yeah, today we're looking at why protection from COVID, whether it's from vaccines or even having COVID, seems to fade so
Right,
fast.
it's a question we've all been grappling with.
It is. And these two new studies from 2024, one in Nature Medicine and one in Science, give us some clues and might even point to better vaccines in the future.
Okay, so let's start with that Nature Medicine study. What makes it so interesting?
Well, for one thing, it looked at people in South Africa who got hit with both Delta and Omicron.
Oh, wow, so they were seeing how immunity held up against very different variants.
Exactly. Plus, they had really good data because they were testing people frequently so they could track antibody levels, infections, the whole picture.
That's awesome. So they weren't just looking at antibodies in a vacuum. What did they find?
Well, the big thing is that those neutralizing antibodies, the ones we usually measure, only explain part of why people are protected from getting COVID again.
Wait, so those antibody tests we've been using, they're not telling us everything.
Not the whole story, no. During the Delta wave, those antibodies gave about 37% protection from reinfection if you'd had COVID before. But when Omicron came along,
Omicron, always shaking things up.
yeah, that protection dropped to just 11%, probably because of Omicron's mutations, which helped it dodge the immune system.
Wow, 11%. That's a huge drop. So what's protecting people if it's not just those antibodies?
That's the million-dollar question. The study authors think other parts of the immune system are stepping up, maybe T-cell responses or mucosal immunity.
Can you remind us what those are?
Sure, T-cells are like the assassins. They go after cells that are already infected, different from antibodies, which try to neutralize the virus before it even gets inside a cell.
Okay, so two different approaches. And mucosal immunity.
That's all about the defenses and the lining of your respiratory tract, your nose, throat, all that. The virus's entry point.
So the first line of defense. Stop it there, and it's game over for the virus.
Exactly. And this is a really interesting clinical point from the study. Even when people did get reinfected with Delta, they were 78% less likely to spread it to their family.
Seriously, that's huge.
Right.
So even if your protection isn't perfect, you're still less likely to pass it on.
Right. Which is something to really emphasize to patients. Okay, ready to move on to that science study?
Yeah, let's hear about it. I know this one made you rethink how we design vaccines.
It did. This study looked at long-lived plasma cells. These are the cells that pump out antibodies for years, even decades sometimes. They're the memory keepers of your immune system.
So they're what give us that long-term protection, the holy grail.
Exactly. But what they found was kind of shocking. People who got multiple mRNA vaccines, even if they'd also had COVID, had hardly any of these long-lived plasma cells specific to SARS-CoV-2.
Uh-oh, not what we wanted to hear. Any ideas why that's happening?
Well, one theory is about how the spike protein is presented in the current vaccines. You see, those long-lived plasma cells form best when B cells, the cells that become plasma cells, can grab onto two spike proteins at the same time.
Like you need two hands to hold on to something really well.
Perfect analogy. Problem is, the way spike proteins are arranged on the virus, and even in our vaccines, they might be too far apart for that two-handed grab to happen easily.
So the spacing might be messing things up, preventing those B cells from getting a good grip and becoming those antibody factories we need.
That's what they think.
Okay, so both of these studies are saying our vaccines are doing some good, but maybe not creating the kind of lasting immunity we're hoping for. What does this mean for us clinically? Where do we go from here?
Well, I think it means changing how we talk to patients about vaccines. We can't promise lasting immunity anymore.
Yeah, it's definitely not the message we were giving out before.
Right. We got to be upfront that booster shots will probably be routine, like the flu shot. And also about those antibody tests. They're helpful, but they don't show the whole immune picture.
Which means we shouldn't make clinical decisions based on just the antibody numbers.
Exactly. Look at the whole patient, symptoms, exposures, their personal risk factors. It's got to be holistic.
This changes how we do public health messaging too, right?
Big time. If we want people to trust us and get vaccinated, we have to be straight up about waning immunity and boosters. And for those of us still learning, residents and such, this shows how fast this field is moving. What we know today could be old news tomorrow.
Stay on our toes.
Right. That's the thrill and the challenge of this. Always got to be learning, be curious, find the latest research so we can give the best care.
Speaking of new stuff, what about those virus-like particle vaccines, the VLPs? Could they be a solution?
Maybe. They basically look like a virus but have no actual genetic material, so they're harmless. But what's cool is VLPs present the spike protein in a way that might encourage that two-handed binding we talked about.
So it's giving the immune system a better target to practice on, like a training dummy.
Exactly. And VLPs are already working for other diseases, so it's promising. We need more research on them specifically for COVID, but it's an area to watch.
Sounds like we need to keep our eyes on the VLPs. Big picture now for everyone listening, especially those on the front lines. What should we take away from all this? What's important going forward?
Well, number one, keep pushing vaccination, even if the protection fades. Vaccines still drastically reduce the risk of serious illness, hospitalization, and death.
So even if you get a breakthrough infection, being vaccinated can save your life.
Absolutely. We also got to stay informed about new vaccine tech, like those VLPs.
Yeah.
If they're safe and work well, they could be a game changer. But until then, advocate for boosters and make sure patients understand why it's important to stay up to date.
Okay, got it. And beyond vaccines, there's still a ton we don't know about immunity to this virus. We talked about T cells and mucosal immunity. Those need more research, right?
Totally. Figuring out how they protect us and how to boost them could lead to even better, more targeted vaccines.
So many questions still out there. But like you said, that's what makes it fascinating.
Yeah, the more we learn, the better we can protect ourselves and our patients. So keep being curious, keep asking those tough questions.
Great advice. Okay, to wrap things up, I just want to highlight a few key points. So, big takeaway number one, those neutralizing antibodies, they matter, but they're not the whole story.
Right, you got to think about T cells, mucosal immunity too.
And don't get too hung up on just the antibody test results.
Yep, look at the whole patient, all their details.
Second big point, the way our current vaccines work with the spike protein, it might be holding us back from getting that really long-lasting immunity.
Which is why research into these new vaccine types like those VLPs, that's super important.
So to everyone out there treating patients, be honest with them. Protection from vaccines fades. Boosters are probably going to be a regular thing.
And don't forget the basics. Masks, good ventilation, hand washing, all that's still important, especially with winter coming.
Right. Got to protect the vulnerable, folks.
This field is changing so fast. Got to keep up with the research. Don't be afraid to ask questions, even if they challenge what we think we know.
It's all about giving our patients the best care, right? That means learning and adapting.
Couldn't have said it better myself. Well, that's all we have time for today, but keep digging into this stuff. We've got links to those Nature Medicine and Science articles in the description.
Disclaimer and bibliography in the description.